Chopra. We'll be starting our meeting. It's 1:30. I would at this time request Rusha to go over our electronic meeting participation speech. Hi, Rusha.
Thank you, Raj. Good afternoon, everybody. My name is Rusha Khan, and I am the committee clerk for the Region of Peel Accessibility Advisory Committee. I'm going to provide a shortened review of the protocols for electronic participation in this committee meeting. Recorded votes are not allowed at committee meetings. The committee chair or I will call for any objections. If you have any objection, please indicate your name and objection. If no objections are stated, the motion will be deemed to be approved. If you are participating electronically and are leaving the meeting, please send an email to council@peelregion.ca to indicate that you are leaving the meeting. If you leave the meeting for any votes thereafter, you will be marked absent. We shall now commence the meeting with the roll call. Please indicate your presence by responding here when called upon. Citizen Member Carolan. Center regrets. Citizen Member Shamila.
Here.
Thank you. Committee Chair Raj is present in the council chamber. Citizen Member Paula. Citizen Member Paula. Citizen Member Mary.
Here.
Thank you, Mary. Councillor Fortini. Councillor Groves. Citizen Member Naz.
Yes, I'm here.
Thank you, Naz. Regional Chair Yanika is present in the chamber. Citizen Member Azar.
Yes, present.
Thank you, Azar. Councillor Mahoney.
Present.
Thank you. Citizen Member Anu. Citizen Member Anu. Councillor Sinclair.
Present.
Thank you. I will now pass the meeting back to our committee chair.
Thanks, Rusha. And now, does any member have to declare any declaration of conflict? No? Then I would request a member to approve the agenda. Are there any new items to be added on the agenda? Sorry. Looks like no. So we proceed with the agenda, and I would request Naz, perhaps you could approve the agenda, please. She's waving. Okay. Thank you. So with this, now we move on to our delegations. And our first delegation is we have delegations. I'm sorry, I thought we had delegations on the digital compliance. So we have no delegations, so we move on to the reports. And now I would request Shauna Marshall and Michael Catrino to give us an update or report on the website compliance as required to be implemented by the province by January 1st. But we have some information today by Shauna Marshall. So floor is all yours, Shauna and Michael. Mikhail.
Hello there. Thank you. Hi there, everyone.
Hi, everyone.
Hi. I'll just commence. My name is Shauna Marshall, and it's a pleasure to be here with you all today. I manage the digital communications team at Peel Region. Now, we've got some very talented folks on our team, one of them being Michael Carteros, who is my colleague, the supervisor of digital marketing, also here with us today. Michael, can you please introduce yourself?
Sure. Hi, everyone. I'm Michael Carteros. I'm the digital marketing supervisor, and our team essentially handles all digital communications, so primarily email and web.
Great, thank you. So if we can get started with the deck, that would be great. Thank you. We're very excited to be here with you today to present an update on the work that we are doing to prepare our website for AODA. The following deck illustrates where we are in our journey, as well as shares challenges we have ahead and solutions that are in place or are in development to help us overcome those challenges. I'm going to throw it over to Michael, who's going to walk you through where we are in our journey and some of those solutions we have in place before he throws it back to me to discuss where we're at in terms of hiring some outside support to help us with this very important work. Over to you, Michael.
Thanks so much, Shauna. And good afternoon, everyone. It's a pleasure to be speaking with you today. So I'm going to start by going over some of the ways that we've improved Peel Region.ca from an accessibility perspective over the last few years. So the improvements that I'm going to go over, they sort of ladder up into the principles of the accessibility standards, which are, perceivable, operable, and understandable. Can you go to the next slide, please? Awesome, thank you. So in our journey, we're really looking at the WCAG 2.0 standard, and obviously trying to meet AA and always trying to go above and beyond where we can. So some of those things that we've done to improve Peel Region.ca are skip navigation. So what this is someone who is using an assistive screen reader. It won't have to go through the navigation on the website. It'll kind of skip over that. So that's one of the things. We also use link anchor labels. So apologies for this particular example. It's not clear what we're trying to convey, but so the example is our website contains information about healthcare. So if you can imagine website being underlined as a link, that wouldn't necessarily give context behind what's behind the link. It would just say, it would just say website. So the corrected version, again, you can't see it, some of the formatting has dropped off, but a better version would be our website contains information about healthcare, where information about healthcare is underlined as a link, and that would give the user context to the page that's behind the link. The principle of operability, so giving people the ability to browse the website via a keyboard, that's what number 3 is about, so focus and tabbing. So folks can use tab to kind of go through all the sections of our website, so from the navigation down to headings and accordions, for example. So that really helps with operability. Can you go to the next slide, please? Thank you. So color contrast, sorry. This has to do with perceivability. So we make sure that the differences between our website background and the text that we put on our website, there's good contrast there to help with just making it perceivable for folks. And we use online tools to make sure that that happens. We also use alt text. So this one's a little bit, I wouldn't say confusing, but many images on the website that you see from time to time, they're more decorative. And what I mean by that is they're used to kind of enhance the visual appeal of the website, but they're not necessarily there to kind of give additional meaning to the content. So in the cases where an image is decorative, such as on our homepage where we had that beautiful young woman with her dog, that's a decorative image. So there's not nothing in that image conveys information. It's just there for decoration. So by leaving alt text blank, screen readers know to kind of skip over that and go straight to the content. Another technique that we use is using unique text labels. So I'm sure you've been on websites where you see, read more, read more, read more, read more. It's easy for people that have, have full vision to kind of get what the context behind the read more. But what we do is we use descriptive language and links. So we would say, read more about this 2020 health report instead of just read more. And that helps people navigate. Next slide, please. Thank you. So area labels is another area that we focus on. So in this example, you'll see the links both say English. So again, someone that has full vision can easily see that masks, that English link relates to masks. On the other side, it's about mandatory masks. But we also, behind the scenes on the code side, we add area labels to kind of give descriptions as to what that actually has meaning for. So that's another area there. And then live chat, we also introduced that in the spring of 2019 with the Customer Care Center. And that just helps people get the information that they need a lot quicker. Next slide, please. Thank you. So our next big step in improving accessibility on peelregion.ca will be our brand new website, which we're going to be launching in phases starting mid-2021. So the new website, it's going to be on all new platform. We're going to have a new design that represents our updated brand. It's going to have enhanced usability and accessibility features, such as breadcrumbs. Again, going back to operability, we're going to have improved ability to browse with the keyboard. Our mobile navigation is also going to be improved. And we would also love to work with some members in the committee to beta test the version, the beta version of it. So what we did when we launched the waste section on our site a few years ago, we actually brought people in that needed assistance, and they really helped us improve the waste section before it went live. So it would be great if we could kind of do that with this team, and we're looking for just any advice that you have, on making our website better as well. Next slide, please. So asset management. A big component of our web operations and our strive to make information as relevant and accessible as possible is asset management. So when I say asset management, I'm referring to the images, the copy, and all the various documents that might be present on the website. Our biggest challenge at the moment is just the sheer number of PDFs that we have that are non-compliant on peelregion.ca. So historically, staff have really used PDFs to kind of expedite publishing. They've used PDFs as a major means of communication. And what I mean by that is, they create a beautiful PDF. They have all the relevant information in there. And then, it's kind of done on their side, and they want to communicate that. So there are, obviously issues with PDFs. Sometimes they're not made to be AOTA compliant. And so this is how we've kind of ended up with our website being an archive of some of this information. A lot of it could be potentially just out of date or even wrong information. As part of that, our current system doesn't really have a way to manage the life cycle of content. So what I mean by that is, from the publishing date to when that information is no longer relevant or it needs to be updated. Right now, all that is done manually by the web team and our communications team. So it's very manual. We're all human, so things do get missed. But in the new system that we're going to deploy in 2021, some of those features will be added. So that'll help us quite a bit. Next slide, please. So now I'll talk a little bit about what we're doing to prepare for the upcoming AOTA deadline and beyond that. So how are we going to keep peelregion.ca accessible and have the most relevant information for all residents? So we are in the process of completing a site audit to reduce the scope of our PDFs, and we started working with clerks on that already. Made some good strides there. We're going to be developing guidelines to rethink ineffective practices. So this one's really key because when you think about AOTA compliance, it's really not just about the website. We want people at the region to think about AOTA compliance and communicating effectively to all residents from the onset. So we're going to be developing some guidelines around there, and leading into that is also we'd like to create a corporate policy to ensure that content placed on the website is accessible. And along the way, we're using checkers, and we're getting ready to conduct training sessions on accessibility with various stakeholders. Also touching on records management accountability. So what we found kind of in uncovering some of these things during our web redevelopment project is that records management on the web, it's not, how can I put it? It's not consistent across the organization. So some groups might publish something with the web team and it kind of stays on the web for 10 years type of thing, and other groups are more active in their records management on the web. So we're going to try to standardize that to make sure that whatever is on the web is accessible and relevant to folks. When we launched our new intranet this year, we actually created a really cool digital champions network along with our DNIS partners. So this was a group of folks that were really technology enthusiastic. They wanted to be there as people that their departments and divisions could go to for help. So we're thinking of leveraging them also to kind of spread the accessibility information across the org. And lastly, we're working with a vendor to produce accessible PDFs that meet those requirements. And Shauna's going to talk a little bit more about that. Over to you, Shauna.
Thanks, Michael.
There we go. Thanks very much, Michael. Can I get the next slide, please? Thank you. So great segue. Thank you. I'm here to talk to you about Expert Consult. So we're working with an outside vendor to provide us with consultation on how to be compliant. I know you're familiar with AbleDocs. I hear they came in to present to you a few weeks ago. We are working with them. They've got great experience in municipality sectors and have already given us much to work with. Recently, they conducted an audit on our website, and it's through those reports that we are mining data to help us inform a PDF reduction and compliance strategy. We're also working with AbleDocs to conduct training sessions in the organization on how to create accessible Word documents and PDF documents. This training is going to be rolled out to the marketing and communication teams and other stakeholders across the organization as we help gear up for this change. Okay, AbleDocs also has a number of other tools that we're looking at implementing on our website, pending our rollout and assessment based on what we can do in-house, and then what we look to for their expertise. And they're listed here on the slide, but working alongside them and the work that we've got on the ground, we feel pretty confident that over the next few months, we'll be able to be accessible, fully compliant on the website. Next slide, please. So Michael mentioned that we rolled out a new intranet called Pathways Plus. It's an all-new intranet built on a Microsoft SharePoint platform. And the good news story here is that Microsoft SharePoint is accessible out of the box. It has a built-in screen reader, and we also have recently linked to the Microsoft Disability Answer Desk as a resource on Pathways Plus to help with any accessibility questions that users might have. Okay, next slide, please. So this takes us to our last slide before we can turn it over to you for questions. But we always have a vested interest in seeking alliances for new ideas, insights, and innovation with partners. And we would really like to work with you on a partnership to test new digital tools that we are implementing, including our website. So we'd love to do a beta test with you on the new site when we are ready. We are planning on a soft launch in Q1, Q2 of 2021. And it would be our pleasure to establish a deepened and meaningful relationship with the AC. Thank you very much. That's about it for us. Any questions?
Thanks, Shauna and Michael. I think you have given a very innovative presentation, specifically with regards to preparing for AODA and seeking partnerships. I can assure you that our committee, all members will be fully willing to assist you in any way that you want to test the new website. So let's see, we have any questions, Rusha? Yes, Mr. Sinclair.
Yes, good afternoon. I had firstly, a very good presentation and some new vocabulary for me anyway. On the page, Our Journey, page 2, number 4, refers to color contrast. And for me, I found it often a bit difficult to interpret graphs in color. So they have the same line weight, but different colors. And I wondered if some thought had been given to using patterns, various arrangements of dots and dashes and so on, or thicker lines in the interpretation of graphs. Is that a concern here for accessibility?
Yes, definitely. So we try to label data as much as possible. So we try not to rely on color when kind of conveying information. So if you, we'll rescan the site for sure to make sure that's not happening. But yeah, patterns is definitely, it's a good way to distinguish between two different kind of data sets. But ideally, it would be through labeling of that data. So if you could put a label on the bar graph, for example, or pie chart.
All right, thank you.
Thank you.
Naz, now you have a question for Sean and Michael?
Yes, thank you, Madam Chair. Yes, Shauna and Michael, thanks for your presentation. I am one of those individuals who uses a screen reader as I live with blindness. So I have the Apple computer and use VoiceOver. So I'm just wondering how, because we all tend to have our own programs, right? So when you work with Microsoft for developing your program, it will work with them. But will it always work with the VoiceOver program that I will use? And for example, I do find headings very useful to navigate a page. So when it says skip navigation, it takes me down to the headings. But I do find if the headings need to be limited, so if on the page, if there's 3 or 4 important headings, I can navigate the page correctly. But if there's going to be 100 headings, then there's no way I can navigate because no one can go through 100 headings and remember where to go. So I would suggest keep the headings limited for the most important items on the page. And secondly, yes, I would be willing to test any programs that or your sites as you develop them. And what my last concern would be regarding updates. As you know, when you work in this field, updates come here and there and sometimes, too often. And that throws us off in terms of once we've learned how to navigate the page, we become familiar, then there's updates and things change. So how can you secure your pages from being becoming unfriendly once there are updates? I'll leave it there for now. Thank you.
Thanks so much for your question, Naz. You definitely bring up some really good points. So on your first point about how can we ensure technology works kind of across the website, that's an excellent question. You know, I downloaded JAWS a few weeks ago, and you need training on it. You know, you can't just jump in and start using these things, right? I'm sure you know that. So I think, you know, to Shauna's point, forming partnerships with you folks and actually working with the people that use the technology is the only way we can do it. And I mean, we can kind of guess and hypothesize, but without actually working with you, we're not going to get there. So my suggestion would be, let's form those, partnerships and work together on it. And the second question was, how do we maintain the updates and to ensure nothing breaks, right? So if you're familiar with the web, you're right, it changes all the time. And our team, you know, our comms team and the web team, shout outs to them, they're on top of technology. We go to conferences all the time. We go to, you know, to webinars. But again, it's about working with you. You know, we can only do so much. There's no substitute for user testing, right? So, yeah, I'll leave it there. Thanks for your questions.
Thanks, Michael. Are there any other questions from other members?
Can I ask a question, if you can hear me?
Azar, okay. Thanks, Azar. Thank you. Yes, you have the floor to ask your question.
Thank you, Madam Chair. Thank you, Sean and Michael, for the presentation. You've made some very good points there. I just want to add to what Naz just mentioned. She was talking about voiceover, and then Michael talked about JAWS. My concern would be that with these new websites, now there are multiple screen readers that people are using. So there was a time that JAWS was the industry standard, and then VoiceOver came in. But now we have NVDA and there's Microsoft Narrator, and new things are coming up. So are you taking care that your website will be usable with multiple kinds of screen readers and also across different browsers? Because sometimes, you know, a website works fine with screen reader on Firefox, but it doesn't work so well in Chrome or, you know, Microsoft Edge. So I would expect that in the future, the website, that the new one that you're developing, it works with multiple screen readers and works with multiple browsers. And as far as our participation and support is concerned, I'm already, you know, involved. I've been helping your teams in PDF accessibility and stuff. So I'll be more than happy to, you know, assist in whatever manner I can. Thank you, Madam Chair.
Thanks, Azar. At this time, would Shauna or Michael, would you like to add any other points in response to the questions raised?
Nope. Azar, thank you for those comments. Yeah, we definitely test on every browser. I would be, we're definitely not there when it comes to having the full suite of accessibility technologies from a testing perspective. So anything you can, any way you can help on that side would definitely be a benefit to us. You know, this is kind of a learning opportunity for us as well in working with you. So we want to make sure our new site is as good as possible. So thank you for your comments.
Thank you.
Are there any other questions from any other member? I just like to say something in conclusion, thanking Shauna and Michael, that you have done a tremendous job in raising issues which are important from accessible point of view, but at the same time, members like Naz and Azar, they are willing to help you in any way that we can to make the site more accessible and more productive and helpful to persons with disabilities. So thanks again a lot, Shauna and Michael, for your wonderful presentation. We appreciate your time, and you have raised some good points. Thanks.
Thank you so much.
Thank you.
Azar, would you like to move receipt of the presentation, please?
Yes, I do.
Oh, thank you very much. Thanks. Perfect. So now we move on to our next report by Dr. Brandon and Andrew Cooper. It's indeed our honor and privilege to have Dr. Brandon here. He's the Associate Medical Officer of Peel, as well as Andrew Cooper, Manager in Emergency Management, to shed some light on the issues raised by COVID-19 outbreak and how the efforts that we have taken, how are they helping the persons with disabilities in the region of Peels. So thank you very much, first of all, for the report that you have shared with us. I would like to request if one of you could present a brief synopsis of the report to help us get going with the thinking process.
Thank you, Madam Chair. And I'll begin just to say thanks, and I'll let Andrew speak to the aspects connected with the Regional Emergency Operations Center, and then I can come back to give an update from the Peel Public Health point of view, if that works. And just wanted to say to begin, thank you very much for the opportunity to join the committee today and to speak about how this pandemic has affected Peel Public Health service delivery, and including the processes to assist people with disabilities. This is a collaboration between the REOC and Peel Public Health. And I'd like to invite Andrew to begin, and then I can speak to the Peel Public Health aspect afterwards.
Thank you very much, Dr. Brandon, and thank you, Chair. So I'll start out by saying that the response that we were seeing to COVID is our longest and most complex response to date. We've been involved in a number of situations, whether they be apartment evacuations, explosions, things like that, where they're very short term in comparison and a small footprint. In this situation, it is a massive footprint, long-term operations, and there's lots of different facets that we're having to address. So the region's response actually began back in January, probably about 300 days ago, if my math is correct, with Public Health, who opened an emergency operations center to start dealing with what was then called coronavirus. And we were seeing that it was happening overseas. A few of us from corporate services were seconded to Public Health in late January, and we began formulating a plan, providing guidance to our stakeholders through January and February, and then into March as the consequences were starting to ramp up. The decision was made to activate the Regional Emergency Operations Center, which happened just before March break. And then we saw a regional declaration of an emergency made on the 18th. To the best of my knowledge, I don't believe we have ever made a declaration of an emergency at a regional level in the past. And this goes back to things like SARS, the blackout of 2003, as well as to the train derailment from Mississauga in 1979, if some of you remember that far back. The number of stakeholders involved in this response is incredible. We have stakeholders internally from every department, pretty much every division, and many, many program areas that have been involved in the response. We've redeployed over 700 staff to deal with various aspects of the COVID response. Many of them have returned back to their home positions, but if you remember back at the early phases of the response, our long-term care settings were particularly active, and so we did redeploy a number of staff there. At a municipal level, each of our municipalities have declared an emergency, and we're working daily with our municipal colleagues to come up with strategies and responses to the various aspects that we're seeing with COVID. And unlike other events where you get a sense of the timelines and when things will start to wind down, this one is very much different in that the consequences are ever changing. The impacts they seem endless, but we seem to have a really good group that's able to adapt to these situations. With respect to accessible needs and vulnerable populations, there's been a number of measures that have been undertaken. One of the big measures that was undertaken was our community response table. And this was a group that was established and the REOC supported when needed. There's approximately 160 community organizations and partners that have collaborated with the community response table. Initially, they were meeting 2 to 3 times a week. And then over, I'm going to say a little bit after Labor Day, the frequency started to taper off, and we're now down to about once a week. And this group is made up of different agencies that support individuals with accessibility needs, addictions and mental health issues, as well as multi-service agencies for things like language, immigration needs, child welfare and wellness, and so on. On a handful of occasions, members of the community response table identified a need for non-medical personal protective equipment. I think most of you will recall back in the spring, masks, gloves, visors, things like that were in short supply. We were fortunate enough at the region to receive many donations from various community organizations, individuals, baseball teams, doctors, all a real broad footprint of individuals. And from that donations, or from those donations that were received, we were able to distribute them to many of the members of the CRT table as needed. So in the cases of food banks, they didn't need non-surgical masks, or they didn't need surgical masks, but there was a need for surgical masks. We were able to redistribute some of that equipment or that material to groups like that. That was done through our logistics section, which was a huge undertaking. We have not typically been involved in donations management in the past, so this was an experience that we developed, learned, and implemented in probably 2 to 3 weeks from the event starting. Another tool that was created, or a function that was created, was our isolation and recovery site that was established by Human Services. And in this particular case, this is a site that is set up for individuals with homeless or with housing challenges and those that are in our shelter system. And it gives individuals an opportunity who might not be able to safely isolate should they need to. It gives them a place and an opportunity to do so, as well as it has wraparound supports from the Human Services side, as well as a medical plan that's available to them, so that if their symptoms do actually develop into COVID, we can keep them in the same facility or same site and monitor their conditions and provide care throughout the hopefully short stay with us. The isolation site and recovery site, it has full wraparound services. So if we find that the individual needed additional supports, whether they be social supports in mental health or addictions, things like that, we have those resources available to them, and we can get them to them very, very quickly. So in March, and I believe there was the COVID-19 Emergency Fund, which was established. And this was set up through Human Services to support approximately 65 not-for-profit organizations with various aspects of their own individual COVID response. Many of these groups provided face-to-face service with their clients with the need to socially distance and create that barrier between individuals. Some of the funding here went to supporting them as they're going to virtual meetings and setting up scheduling and things like that, and that continues to this day. Other things that were included as part of that were food security and services for individuals at risk, including many children and youth. one aspect that we do have, or one portfolio that we do have at the Region of Peel, is our Peel Housing Corporation. And within Peel Housing Corporation, there's approximately 25% of the individuals who are seniors. As many of, as we all know, we haven't been able to interact with our family members the way we normally would. It's been a long time since I've gone to my parents for a cup of tea. Sorry. Yeah, it's been a long time since we've connected with individuals. So we wanted to make sure that we had the supports available for individuals in these settings where they couldn't connect with their friends and their colleagues in the apartment buildings or in the Peel Housing Corporation sites. So we looked for new opportunities. There is now a wellness program that's been established to reach out to these individuals on a weekly basis. And if needed, there are supports there for pharmacies, for food supports, even fire and life safety concerns that may develop. So, and this is something that continues and is quite active. Probably one of the biggest challenges with any event is always the messaging, getting the right messaging, getting it out to our stakeholders on time, making sure it's coordinated with our stakeholders. And given the broad range of stakeholders that we have involved, this has been a huge effort. And I cannot acknowledge the efforts of communications enough for this one. It's quite something. So communications has been very vital. You heard in the previous presentation about improvements to our website, including a virtual assistant translation services. Those are just a small portion of the larger response. When our communications folks are developing materials, they make a real conscious effort to ensure that the language is plain spoken. It's not too complex. There's high visibility in the graphics. They work with a number of stakeholder groups to ensure that they're meeting the mark as best as possible with the messaging. Some of the messaging has to be developed on short notice, and we don't really have that luxury of being able to do a lengthy consult. But for those situations, we turn to best practices that we've learned over the past few weeks and few months. And with that, I believe I'm going to turn it over to Dr. Brandon.
Well, thank you very much, Andrew. And this has really been a collaborative effort, our pandemic response with our regional partners and our external partners afterward in the greater response overall. Peel Public Health has had to, as part of our pandemic response, to reduce its overall service levels. This was done so that staff could be redeployed into the COVID response. About 80% of all of our staff have been deployed in the COVID response itself at this point. And because of that, we needed people from throughout our organization to focus on means to reduce the viral transmission in the community. And this is done through things like case and contact management, the outbreak management, and we are working closely with partners in long-term care, other types of group living settings, workplaces, and schools to, whenever we see that there's an outbreak identified there, our internal teams work with those settings to address and reduce the spread. As a consequence of having everybody working on the COVID response, we are maintaining certain critical public health programs and services, but those that are open are still at reduced capacity. These critical services that are continuing to function during the COVID response include the management of urgent reportable diseases. Those are things like tuberculosis or hepatitis B and C, immunization clinics for influenza or school catch-up clinics, the provision of harm reduction supplies and supports, and telephone-based infant feeding programs. These critical programs are maintaining the regular processes to support accessible services to the clients that require it. So that would be things like accessible format of the print and web information, as well as translation services. Specific to our COVID response, we have processes in place to assist people who have disabilities or accessibility needs, and this includes, as part of our operations, we're doing individual case and contact exposure and outbreak management, and we include in that any accessibility considerations for people that we're working with on a case-by-case basis according to that person's needs. If accessible services are required, our case and contact management team will reach out to partners and try to problem solve based on what is needed to help with that individual. And this includes things like advocating for continuing home services provision for people that have medical needs within a home, giving additional direction on how to use personal protective equipment within the home if there's people coming in to assist, helping access food deliveries, providing alternative methods of testing. And really, I do have to recognize the exceptional work of our paramedic colleagues in helping with assisting with this, and working with TransHealth to ensure that there are transportation options for people, as long as the appropriate precautions are place if people are either isolating because they have COVID or they've been exposed to COVID. We also provide infection prevention control advice, and we manage outbreaks in group living situations, which includes the long-term care homes, the retirement homes, group homes, and shelters. We work directly with the on-site staff just to ensure that the vulnerable residents are protected, and this includes making sure that there's testing options for COVID-19 available on site when needed, that we give specific advice on the precautions needed to take within these settings to reduce the transmission of the virus, and that the homes are able to recognize and respond to any potential cases of this infection. We are working very closely with our regional partners. This includes Ontario Health and the LHINs, as well as the hospitals who manage the assessment centers, to plan any community testing initiatives. And those include ones which may be serving vulnerable populations. And we have our integrated response table as well, where we work on a regular basis just to respond to any outbreaks or potential concerns in congregate settings. I really appreciate the opportunity to come and speak today to this committee meeting. I'm definitely happy to answer any questions and if there's any feedback from members of the community about our response or that they're hearing within the community, as well as we're looking to keep evolving our provision of services during the sustained COVID response. Thank you very much.
Thank you, Dr. Brandon and Mr. Cooper. It was a great presentation. You did cover a broader perspective of involving the different levels of government and taking actions in different areas, which I guess are helping or will help in controlling the surge of COVID-19. Risha, we have any questions? Hi, Naz, you have a question, so you please go ahead.
Thank you. Thank you to both of you for taking your such critical time to present us with that report and your statements. I can't commend the Region of Peel and every single individual who's working in the COVID prevention to the amount of work you've done. You know, as a person living with disabilities, I'm overwhelmed with what is available to us out there. When I've called, I've received absolutely the full consideration. So, my heart goes out to everyone who's working so hard. And you're so right. When we looked at disaster management over the years, we had never in our wildest dreams thought we would face such a crisis and to such an enormous extent. There's a saying that it states, if you're hearing it, it's news. If you're reading, it's history. So obviously we're in the hearing stages of what is happening and still going on, possibly for the next many months yet. And then history will tell us later on what we did really well and where we possibly could have done better. But that's okay. That's how we always learn, right? To improve as we go into further, I don't want to say disasters, but that's what life is, right? As things go on, we always improve how we address them. Of course, I'm concerned about the individuals who are more isolated and have more multiple disabilities. From what I've heard in my own network, a lot of people are coming together with families and friends, and literally everyone is gearing up to help each other. So there's a lot of, interpersonal, work going on, which is really, really good. But individuals left alone, I guess we won't know if we have failed them. I hope not. I hope each one of us can get around to helping one another. So it's mainly, I just want to give comments to say that you've done a great job, and I'm proud to be a resident of Peel, although I know we're facing a tough time, but hey, we'll get through this together. So I'll let my other colleagues address. Thank you so much.
Thanks, Naz. Thanks for your comments. Any other questions, Rusha? Azar, would you like to ask any questions to the presenters?
No, thank you. I don't have any questions.
Before we move any further, I like to make one comment, Dr. Brandon and Mr. Cooper. With due respect, you have done a great job. But one thing I noticed, we have in the province we have a Accessibility Act, which is Accessibility for Ontarians with Disability Acts, and it does set out certain procedures which must be taken into consideration by all private sector, broader public sector, municipalities, and all the employers in the province to take into consideration in while they are undergoing any emergency situations. So one of them that I thought maybe you are doing it, but I did not get it from the report, and that was in terms of taking into account all a safety and concerted effort to respond to the needs of public persons with disabilities in your emergency announcements. Are we taking enough steps to inform that the public persons with disabilities that this is what the region is doing, and if you need any help, come forward? And the second point was that whenever any announcements are made, perhaps it should be done with proper captioning and American Sign Language interpretation for the proper understanding of the persons with disabilities. So just to reiterate this point, that all the good work, which is a lot, we are doing in the region of Peel is fully made available to persons with disabilities, that they know that this is what is happening in our region, and if we need help, this is what we need to do. That's all I had to say, and I'm sure you will take steps to ensure that they are properly informed about any emergency planning and any emergency measures which will be taken in the future. As it appears, COVID-19 doesn't appear to be going soon. There continues to be a surge day by day, and again, in the region of Peel is one of the three hotspots regions. So this is my only request, that we make proper plans to ensure that the person with disabilities are fully made aware of what is happening, what is the regional government doing to assist them, to help them get proper treatment before getting sick with the COVID-19. So having said that, so thanks again a lot. I think you have covered all major points. The 6 points listed in your report were very well laid out. So with that, thanks again, and thanks for your time.
Thank you for having us.
Thank you very much.
Okay. Now, I would like a member to move the receipt of this report by Dr. Brandon and by Mr. Cooper. Naz, oh, you are waving. So we have, the report is moved by Naz Hussain. Thanks, Naz. So I'm advised, now Rusha advises me that we have to go back to point 5, item 5.1, and we have to move the recommendations made in the report. So would Mary or Shamila, one of you, move the recommendation? Thanks, Shamila. I can see your moving. So thanks a lot for moving the recommendations. So with this now, we move on to 5.3, which is an update on the accessibility planning program. And I will request Veronica to give us an overview of the accessibility program in the region of Peel. Thanks, Veronica.
Thank you, Madam Chair. I'm not sure if my video is on.
Hi, Veronica. So we can hear you
Hi.
in the chamber, but we do not see your video.
Can you see me now?
No, I do not.
Okay.
I do see a little triangle, which probably means it's a low bandwidth, so you can keep your video off.
Okay.
Mhm.
It's possible
Thank
that I am
you.
having technology difficulties. Can you hear me?
Yes, we can hear you.
Yes.
Okay. Okay. So we'll go without the video. My apologies. I think I'm having some technical difficulties at my end. So thank you very much. You have the report before you, and it is an update on what the accessibility planning program has done since our last meeting. I just wanted to add a few items in addition to what you have before you in the report. You will notice that I did make mention to the update to the AAC terms of reference. So I just have this on the report just for information to the committee that the terms of reference have been updated, and they were updated to reflect a more consistent and standardized approach for all committees of council. So it's not just the AAC that that's been updated, it's all committees of council. So just to bring all committees into a more consistent and I guess standardized process. The most notable change with these terms of reference for the AAC is that the AAC chair and vice chair will now form part of the interview panel during membership recruitment. So in the past, it hasn't been practice for the AAC chair and vice chair to participate in the recruitment. However, we're incorporating this as part of the new update. And I've shared the most current terms of reference with you and it's in your agenda as an appendix. I also wanted to provide the committee an update on the IDPD observance for this year. And so as I mentioned before, given that most of the attention and the resources have been focused on the pandemic, this year we will be observing this day virtually through an awareness and education campaign. We will be following the theme declared by the United Nations, which is building back better towards a disability inclusive, accessible, and sustainable post-COVID-19 world. As you're aware, and from the previous report, people with disabilities are among the most vulnerable people in our communities and have been particularly impacted by the pandemic. So the aim of the campaign for this year's IDPD will be to highlight some of the effects of the pandemic on persons with disabilities and what can be done to improve the lives of this high-risk group during such difficult times. So it is an awareness and education campaign. And we are, obviously, it will be shared with the AAC members, and part of that information will include what the region is doing to assist persons with disabilities. So once I do share that campaign with you, I could appreciate it if you could also pass that on to your networks to commemorate the day. And just one final reminder, I sent an email, I believe, earlier this week with regards to the upcoming Abilities Virtual Expo. This year, the expo will be conducted virtually, and it will be taking place this weekend. And be sure to check out the expo. We have our very own Carol Ann Chaffee and Mary Daniel, who will be presenting at the expo. And they'll be presenting on building your employability is the name of their workshop. And it is scheduled for tomorrow at 4:30. So make sure to check out the expo taking place all weekend, starting tomorrow in the morning. That is the end of my update, and I welcome any questions from committee members.
Thanks, Veronica. Let's see. Naz or Azar, do you have any questions or any other member have any questions?
No questions, but hey, Veronica, I'm missing you. How are you doing?
I'm good, thank you, Naz.
Okay. Keep well.
Miss you guys.
Yes.
So as usual, Veronica, you are indeed doing a good job. Oh, we have a question from Azar.
No, I just said I don't have any questions, and thank you, Veronica.
Yeah.
Thank you.
So thanks, Veronica. You gave a good overview, and the report was well done. I would request a member to move the receipt of the report.
I will. Mary
Okay,
Daniel.
Mary. Thanks, Mary. Moving along, we have two communications. One from the town of Amherstburg, and second is from the city of Belleville. And both are with regards to requesting, well, let's deal with one by one. The first is from Tammy Fox, deputy clerk from town of Amherstburg, and they are requesting the province of Ontario for an extension for their website compliance. And as well, they are requesting some funding and training resources from the province, and they have shared this information with us. So this is for our information. And the second communication is somewhat similar from the city of Belleville, Matt McDonald, their director of corporate services, and in which there's not much mention of extension, but they have requested funding for preparing the website and as well as training support. So I think it's good to stay connected, and the two municipalities have shared this, and also, as you will see on their letters, they have CC'd, at least the Belleville has CC'd it to other municipalities and the Association of Municipalities of Ontario. So that's a good news that the news is being shared across Ontario. So having said that, does anyone have any questions? Well, then I would simply ask maybe Mr. Sinclair to move the receipt of these two communication items. Thank you, Mr. Sinclair. So with this, our meeting for today, agenda is complete and it's finished. And does anyone have any other business to report?
Madam Chair, it's Naz here. May I ask one question?
Yes, please.
It's regarding our agenda package. I didn't find the minutes in it, and it wasn't followed up today, like a receipt for the minutes of the previous meeting, September. Can Rusha, can you speak to that possibly? Was it in the package? Is it something I missed?
Hi, Naz. Sorry about that. No, it wasn't included in the package. I will share that with the committee members and make sure to have it on our next agenda.
So it was just an item that was missed in the package, correct?
Yes.
Okay. Okay. Thanks for that information.
Thank you.
Any other questions from any other member? Well, this week, our last meeting of the year 2020, and I would like to provide the next meeting will be in the next year, March 4th, 2021, same time, same venue. And in the meantime, I wish you all a very happy, safe time. Christmas is approaching, but I think I will be following the public health guidelines. And I think I'll request all of us to follow the guidelines and join hands together in controlling the surge of COVID-19 in Ontario, in the province, in the world, all over. So with having said that, thanks very much for your participation during all the meetings. And with that, we will end this meeting.
Sorry, one sec. Naz, just wanted to clarify. So committee minutes actually go to the regional council agenda to be approved. If you'd like, I can share the copy of the minutes with you. I can email them to you after our meeting today.
Yes, Rusha, I would appreciate that. Also, I think it should always be in our package. This way it gives us, the ability to just review what was, for example, this meeting, by the time we meet in March, we don't remember what we discussed. So having the minutes in that package, we can reflect on what was discussed a few months before. So I would appreciate that if that's possible. If any other members have any comments, they can add to it.
Definitely, Naz. We can definitely do that. Thank you.
So now we need a mover to adjourn the meeting. Oh,
will.
Shamila? Okay, Shamila, thanks. So with this, the meeting is adjourned. And as I said earlier, have a happy time. Christmas time is coming, and we'll see you sometimes on next year in the month of March. Thank you.
Thank you.
And Rusha, can you disconnect me, please? Because I have to